What is depressive disorder? Understanding the symptoms and causes. Depressive disorder, also known as major depressive disorder, MDD, is a common but serious medical condition that affects how a person feels, thinks, and behaves. It causes persistent feelings of sadness and loss of interest, which can lead to various emotional and physical problems. People with depression may struggle to carry out everyday activities and can experience feelings of worthlessness or guilt. Understanding the symptoms and causes of depressive disorder is essential for identifying it early and seeking effective treatment. Symptoms of depressive disorder. Depressive disorder presents itself in a range of symptoms, which can vary from person to person. The symptoms may be mild, moderate, or severe, and they often interfere with daily functioning. Some of the most common symptoms include persistent sadness or a feeling of emptiness that doesn't go away, loss of interest or pleasure in activities that were once enjoyable, including hobbies, social activities, or work, changes in appetite or weight, either significant weight loss or gain, difficulty sleeping or sleeping too much, often waking up tired, fatigue or a lack of energy, even after adequate rest, feelings of worthlessness or excessive guilt, often without a clear cause, difficulty concentrating or making decisions, thoughts of death or suicide, or attempts of suicide, physical symptoms, such as headaches, back pain, or digestive problems, that do not have a clear cause. For a diagnosis of depressive disorder, these symptoms must persist for at least 2 weeks and represent a significant change from the individual's normal functioning. They must also cause distress or impair the person's ability to function in daily life. Causes of depressive disorder. The exact cause of depressive disorder is still not fully understood, but it is believed to result from a combination of genetic, biological, environmental, and psychological factors. 1. Biological factors. Depression has been linked to changes in brain chemistry and function. Neurotransmitters such as serotonin, norepinephrine, and dopamine play a key role in regulating mood, and imbalances in these chemicals can contribute to depression. Research has also suggested that brain structure and activity may differ in people with depression. Areas of the brain responsible for mood regulation, like the prefrontal cortex, may function differently, affecting emotional responses and decision-making. 2. Genetic factors. Genetics also play a significant role in the risk of developing depression. Individuals with a family history of depression are more likely to experience the disorder themselves. However, depression does not follow a simple inheritance pattern, and other factors such as environmental influences also contribute. Studies suggest that multiple genes may be involved in increasing susceptibility to depression, but more research is needed to fully understand this genetic connection. 3. Environmental stressors. Environmental stressors can trigger or exacerbate depressive symptoms, especially in individuals who are already vulnerable due to biological or genetic factors. Some common life events that may contribute to depression include loss of a loved one, for example, through death, divorce, or separation, financial difficulties or job loss, chronic stress from work, school, or relationships, traumatic events, such as abuse, accidents, or natural disasters, social isolation or lack of support systems. The stress of these experiences can overwhelm an individual's coping mechanisms, leading to feelings of helplessness and sadness that persist beyond the acute event. 4. Psychological factors. Certain personality traits and thought patterns can increase the likelihood of developing depressive disorder. Individuals with a negative self-image, low self-esteem, or pessimistic thinking patterns may be more vulnerable to depression. Additionally, individuals who tend to ruminate on their negative thoughts or events may be more prone to prolonged periods of sadness and emotional distress. Cognitive distortions, such as all-or-nothing thinking or catastrophizing, are common in people with depression. These patterns of thinking can reinforce feelings of hopelessness, making it harder for individuals to see a way out of their emotional distress. 5. Hormonal changes. Hormonal changes can also play a role in the onset of depression, particularly in women. Events such as pregnancy, childbirth, and menopause can lead to hormonal fluctuations that contribute to mood changes and may trigger depressive episodes. Postpartum depression, for example, affects some women after childbirth, with symptoms of depression arising due to the combination of hormonal changes, sleep deprivation, and the challenges of adjusting to a new life. Risk factors for depressive disorder. Several factors may increase an individual's risk of developing depressive disorder. These include previous episodes of depression. If someone has had depression before, they are at a higher risk of experiencing it again. Chronic medical conditions, conditions like diabetes, heart disease, and chronic pain can increase the likelihood of depression. Substance abuse, alcohol or drug misuse can either contribute to or result from depression. Sleep disorders, conditions like insomnia or sleep apnea can exacerbate depressive symptoms. Trauma and abuse history, a history of physical, emotional, or sexual abuse can significantly increase the risk of depression, especially if experienced during childhood. Treatment for depressive disorder. Depression is a treatable condition, and several options are available to help manage symptoms and improve quality of life. Treatment typically includes a combination of psychotherapy, cognitive behavioral therapy, CBT, interpersonal therapy, IPT, and other forms of therapy can help individuals understand the root causes of their depression, learn coping strategies, and change negative thought patterns. Medications, antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, and others, can help balance neurotransmitter levels in the brain and improve mood. Lifestyle changes, regular exercise, proper nutrition, and good sleep hygiene can complement treatment and reduce symptoms. Support systems, building a strong network of friends, family, or support groups can provide emotional support and reduce feelings of isolation. Conclusion. Depressive disorder is a serious but treatable condition that affects millions of people worldwide. Its symptoms can be deeply distressing, but with the right combination of therapy, medication, and lifestyle changes, individuals can manage their condition and lead fulfilling lives. Understanding the symptoms and causes of depression is the first step toward recognizing the disorder and seeking appropriate help. If you or someone you know is struggling with depression, it is important to reach out for support and explore the treatment options available to improve mental and emotional well-being.